This Surgeon General's advisory is in response to high rates of marijuana use among pregnant women and young people, widespread and growing access to increasingly potent marijuana through legalization at the state level, and a mounting body of evidence of harms.
We don't know everything we might want to know about this drug, but we do know a number of things. It is a dangerous drug. For many, it can be addictive, and it's especially dangerous for adolescents and pregnant women because of what we know about how it affects the developing brain.
Not enough people know that today's marijuana is far more potent than in days past. The amount of THC, the component responsible for euphoria and intoxication, but also for most of marijuana's documented harms, has increased 3 to 5-fold over the last few decades. And that's before you take into account concentrated forms such as edibles, oils, and waxes that can increase THC delivery even further by as much as an additional 3-fold. Or as I like to say, this ain't your mother's marijuana. Science tells us that young people who regularly use marijuana are more likely to show a decline in IQ and school performance, are more apt to miss classes and ultimately drop out, and they are even more likely to attempt suicide. Marijuana use during pregnancy can affect the baby's brain and also result in lower birth weight, a marker for early death and disability. Marijuana is now the third most commonly used illicit substance in adolescents, behind alcohol and e-cigarettes. Nearly 1 in 5 people who begin marijuana use during adolescence become addicted. You can become addicted to marijuana.